So, good day. We'll be discussing about blood gases, pH, and buffer systems. So, the first is acid. When we say acid, it is a substance that can donate hydrogen ions, and it can donate hydrogen ions when dissolved in water. So siya yung nagdo-donate ng hydrogen ions. While base is a substance that can accept hydrogen ions. Sila yung nag-accept ng hydrogen ions. Buffer. It consists of a weak acid and a salt of its conjugate base, and it resists the change in pH upon adding acid or base. And ang effectiveness ng buffer ay nakadepende sa negative log of the buffering system and the pH of the environment in which it is placed. Buffer consists of a weak acid such as carbonic acid and conjugate base such as bicarbonate. pH defined as the negative log of the hydrogen ion concentration, and a decrease of 1 pH unit, it represents a tenfold increase in hydrogen ion concentration. pK defined as the negative log of the dissociation constant, and acidosis has a pH below the reference range less than 7.34, and ang acidosis ay may be caused by a primary non-respiratory abnormality or by a primary respiratory problem. While sa alkalosis, it has a pH above the reference range greater than 7.44, and it can result from non-respiratory and respiratory causes. So number 2 is the 4 parameters used in assessing the acid-base balance of the body is, the first one is power of hydrogen. Second is partial pressure of carbon dioxide. Third is partial pressure of oxygen. And last one is the bicarbonate. So third, what is the relationship between oocyst and emia? The suffix oocyst refers to a process in the body, while the suffix emia refers to the corresponding state in blood. So ang relationship ng dalawang to is that ang oocyst ang nagkokos ng emia. Yun lang. Next reporter.
So the next, here in the bicarbonate carbonic acid system, these are the 3 reasons why this is an important buffer. So the first one, the carbonic acid dissociates into carbon dioxide and water, allowing the carbon dioxide to be eliminated by the lungs and the hydrogen ion as water. The second one is changes in carbon dioxide modify the ventilation or the respiratory rate. And the last one, we have the bicarbonate. Concentration can be altered by the kidneys. So this is the next one, which is the buffer system, the phosphate buffer system. The phosphate buffer system, it is play a role in plasma in red blood cells, and it is involved in the exchange of sodium ion in the urine hydrogen filtrate. So for your information, carbon dioxide is the end product of the most aerobic metabolic processes. So let's move on to the role and significance of the lungs and kidneys. So the role or the significance of the lungs is that the lungs, by responding within seconds together with a buffer system, provide the first line defense to changes in acid-base status, while the kidneys role in maintaining acid-base homeostasis is to reclaim bicarbonate from the glomerular filtrate. So the next is by Andrea.
Arterial blood gas reference ranges at 37 degrees Celsius. pH 7.35 to 7.45. Partial pressure of carbon dioxide naman or millimeters of mercury is 35 to 45. And bicarbonate, millimoles per liter ay 22 to 26. Total carbon dioxide content naman, millimoles per liter ay 23 to 37. Partial pressure of oxygen, millimoles per liter, 80 to 110. Oxygen saturation percent, greater than 95. Same with oxyhemoglobin, greater than 95 din. What is meant by compensation? Compensation is the action or mechanism wherein the body's cellular and metabolic activities are pH dependent. So yun, the body tries to restore acid-base homeostasis whenever an imbalance occurs. So yun, sinusubukan ng katawan na i-restore or ibalik yung acid-base homeostasis sa tuwing may imbalance na mangyayari or nangyayari. And also, the body accomplishes this sa pamamagitan ng by altering the factor not primarily affected by the pathologic process. Ito naman sa fully compensated and partially compensated. Pag sinabi natin fully compensated, it implies that the pH has returned to the normal range. 20:1 ratio has been restored. And partially compensated naman implies that the pH is approaching normal. So yun, halimbawa, kung ang pH ay wala pa sa normal range o papalapit pa lang sa normal range, ito ay tinatawag nating partially compensated. Pero kapag ang pH naman ay bumalik na sa normal range nito, ay ito ay tinatawag nating fully compensated. So yun lang, next.
The next part is the acid-base balance disorders, which are the metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. So the disorder caused by the ventilatory dysfunction is what you call the respiratory acidosis or respiratory alkalosis, which yung primary organ affected is the lungs, and the disorder caused by the metabolic or renal dysfunction is what you call the metabolic or acidosis and metabolic alkalosis, and the primary organ affected is the kidney, which changes the level of bicarbonate. So first one, we have the metabolic acidosis, which is mainly caused by the direct administration of an acid-producing substances such as ammonium chloride or calcium chloride, or the excessive formation of organic acid seen in diabetic acid ketoacidosis and starvation. As well, it is also seen in reduced excretion of the acids seen in renal tubular acidosis, and the excessive loss of bicarbonate seen in diarrhea or the pancreatic or intestinal fistula. So for the metabolic acidosis, there is a loss of bicarbonate. The next is the metabolic alkalosis, which may result from the excess administration of sodium bicarbonate or through ingestion of bicarbonate-producing salts such as sodium lactate, citrate, and acetate, which is seen in sa vomiting, nasogastric functioning, or prolonged use of diuretics. So the difference between metabolic acidosis and alkalosis, that metabolic acidosis, there is an loss of bicarbonate, while the metabolic alkalosis, there is an excess bicarbonate. Next is the respiratory acidosis, which is regulated in the medulla of the brain chemoreceptors present in the aortic arch and carotid sinus responds to the levels of hydrogen ions, oxygen, and carbon dioxide in blood and cerebrospinal fluid. It is seen in patient with chronic obstructive pulmonary disease, for example, when there is a destruction or changes in airways, the alveolar wall sizes increases, resulting to a decrease or reduce size ng airways. Kaya naging limited lang yung gas exchange. And the next is the respiratory alkalosis. There is an excessive elimination of carbon dioxide by the lungs, and it causes hypoxemia, chemical stimulation of the respiratory center by drugs, and an increase in the environmental temperature, fever, hysteria or hyperventilation, pulmonary emboli, and pulmonary fibrosis. So the difference between respiratory acidosis and alkalosis, that respiratory acidosis, there is an excess carbon dioxide accumulation, while the respiratory alkalosis, there is an carbon dioxide loss. The next is the compensation of this. Okay, baba. Compensation involved in this basic abnormal states. So the metabolic acidosis, since there is a loss of bicarbonate, bababa si carbon dioxide, which may lead to an increased rate of breathing, resulting to hyperventilation. While the metabolic alkalosis, since there is a excess of bicarbonate, bababa si carbon dioxide, and tataas yung there is an increase in carbon dioxide and tataas yung rate of breathing, resulting to hypoventilation. And for the respiratory acidosis, the carbon dioxide is retained in the blood, causing an elevated level of partial pressure of carbon dioxide, which may and because of that, since there is a elevated partial pressure of carbon dioxide, the kidneys will retain the bicarbonate and will increase the excretion of the hydrogen ions. For the respiratory alkalosis, since there is an excessive loss of carbon dioxide, there's an excessive loss of carbon dioxide because of rapid breathing, and magkakos yun ng hyperventilation and will excrete the bicarbonate in the urine and reclaim the hydrogen ion to the blood. So the next is the laboratory methods for acid-base balance determination in the body. So we have the assessment of the patient's oxygen status, the oxygen saturation, functional or oxyhemoglobin, the trends in oxygen saturation, which is assessed by the transcutaneous, and the partial pressure of oxygen dissolved in plasma. For the oxygen saturation, they represents the ratio of the oxygen bound to the carrier protein. And for the functional or oxyhemoglobin, this is the ratio of the concentration of oxyhemoglobin to the concentration ng total hemoglobin. And the transcutaneous, it is a non-invasive procedure which is directly done on that is done by using a non-invasive procedure. It is a non-invasive procedure done to monitor the partial pressure of the oxygen by directly placing the electrodes on the skin of the patients. And the next is the spectrophotometry, which usually determines the actual percent of the oxyhemoglobin, or determines the oxygen saturation. And then we have the electrodes, or these are the blood gas analyzers. Yung electrodes, they have of oxygen and partial pressure of carbon dioxide. For the pH and partial pressure of carbon dioxide uses potentiometry. Um, yes, and the reference electrode used is the calomel, or the calomel and silver electrode, but the most commonly used is the glass electrode. For the partial pressure of oxygen, we use the Clark electrode, which measure the amount of current flow in a circuit that is related to the amount of oxygen being reduced at the cathode. And for the partial pressure of carbon dioxide, we use the Severan-House electrode, which is an outer semi-permeable membrane that allows carbon dioxide to diffuse into a layer of electrolyte. And that's it for the blood gases, pH, and buffer system.